I would like to give Bindu also opportunity with that question in terms of, I think it's so important, the successes that we've seen in countries. Do you have something that you would like to share, Bindu?
I would second whatever has been said, and I would just like to emphasize that whenever we are having these awareness campaigns, again, I would like to put in that it is very important to address the issue of the risk factors which could lead to hypertension, but also to emphasize that hypertension need to be treated. Every time that has to go into the public, that hypertension is just not recognizing and knowing that you're hypertensive. And secondly, as healthcare professionals, I feel that all of us to stand together and get this opportunistic screening. Each and every patient who walks into the hospital for whatever reason it may be has to have his blood pressure checked. That has to be mandatory. That should be made as a rule, and it should be underlined. And I suppose most patients, most individuals would have that opportunity, and hypertension could be detected in that manner as well.
I cannot agree more. I think you've given all such excellent responses. We now have 5 minutes left of this webinar, and I would now like each of you to give in 1 minute a short indication of what would be your key intervention to reduce hypertension and stroke. If you had one key intervention, what would that be? I'll start with you, Dan.
Okay, good. Thank you. All right. Very, very quickly. Again, I'd like to go back to the awareness, the knowledge, the ability to treat. One of the things that we did add very recently is a very, very simple thing, a very, very cost effective. We've spoken about awareness, but also among the providers. Basically, how do you measure blood pressure? What's the proper procedure for measuring blood pressure? A very simple thing. And we did it with just very, very simple, and each of you, everyone on the panel has done this type of thing, but we got this in our particular case in our region of the country, which is the stroke belt of the United States. We implemented basically just simple blood pressure measurement, but we called it a hypertension policy, just writing down, this is what you do, all the things that each of you know for an accurate blood pressure measurement, and talking about the hypertension team and how they do, and just simply said, this is what your clinic should do. And the cost on that was we gave, if you did it, we gave you a certificate that says your clinic complies with this therapy. Just something very, very simple. But I think going back to the theme of an accurate blood pressure measurement and awareness.
That's a key point. I think that's a mistake that's being made in many GP practices and everywhere. So it's very important to refresh on how to do it correctly. Sheila.
Well, I think it's very important to know how to measure blood pressure, but it's very important to know the goals, because the health professionals don't know. It's very common to say, this blood pressure is good for you, is 150, it's systolic blood pressure, but for your age is good. We cannot accept this, and I think the education is the key to improve the control of hypertension.
Absolutely. Thank you, Sheila. Bindu?
As blood pressure measurement is mandatory, and I would also add that community engagement is absolutely necessary, so that we engage with persons with NCD and see that they are empowered to get a hold of their risk factors on their own, and that should go a long way put all together.
Very important, community engagement, absolutely.